time now to kick off our new series, Project Wellness, and we're looking at some new complementary therapies that are being used to treat chronic medical issues. One simple treatment, salt therapy, which might be one of the best kept secrets, and ABC's Kana Whitworth checked it out.
Sure, it can make your food taste better, but did you know it might actually make you feel better? Salt therapy, aka halo therapy, has been around for, well, as long as salt has, but it's only now gaining ground in the U.S.
Salt therapy is simply breathing in salt air. It's detoxifying, anti-inflammatory.
The treatment is simple. Just sit, relax, and breathe. A halo generator does all the work.
The generator pulverizes the salt into tiny breathable particles. Very powder fine, it can enter the pores, and blows that into the room.
I think it might be like the world's best kept secret.
For Dominique, it has been life-changing.
I'd been suffering with a skin disorder all this year. It's like very itchy hives and all over, head to toe. And I mean, it was hard for me to sleep at night. It was really causing me a lot of distress.
She says she tried everything with no relief until this.
A lot of the improvement that I'm feeling is the inflammation and the relief of having itchy skin all day long.
Beyond skin conditions, salt therapy claims to help with allergies, cystic fibrosis, and chronic respiratory issues.
I've always had bronchitis, asthma, asthmatic tendencies, and allergies. Every morning, just a lot of wheezing, coughing.
After seeing progress in just 3 months, Rob says it's now become part of his lifestyle.
My breathing feels just better. It just overall changed my attitude toward managing what I need to do for myself.
And experts say that is the key here. It's not a cure, but rather an all-natural way to manage your ailments.
We're talking about something that may, based on patients' report, improve symptoms of chronic lung diseases of various kinds.
For Good Morning America, Kana Whitworth, ABC News, Los Angeles.
It is pretty fascinating. ABC senior medical contributor Dr. Jen Ashton joins us now. Jen, this is fascinating, but we have some examples. Here's Himalayan salt and then regular table salt that they would use in salt rooms here in New York. Are there dangers in this kind of treatment?
So first, there's some medical perspective here. In a hospital setting, we use salt aerosolized in the form of nebulizer treatments to help breathing. We use it intravenously. It's called hypertonic saline. So there is some science there. What there isn't is good data on these salt chambers yet, but I think in terms of risk-benefit, the risks are probably pretty low. Irritation to breathing is a possibility. Of course, it can irritate your eyes or your skin if you're sitting on a block of this. And then cost. It's going to vary place to place.
Exactly. As a doctor, would you recommend this type of therapy and treatment?
Gosh, well,
Put you on the spot.
I know, not at the expense of something that's been subjected to rigorous scientific study, and not instead of. So if it's an either or, no, because we need more data. If it's in addition to something, or if you're adding it to a wellness program, I think everyone can consider it for themselves. I'm going to admit, I'm going to try it.
You are going to try it.
I'm a sucker for marketing, and I will try it.
Those testimonials got you,
I'm going to
you?
sit on this block of salt.
She is going to do that. Right here, you're going to be doing a live demo right after the show. You can watch that live demo on Twitter. Your Twitter handle is Dr. J. Ashton.
That's
so
right.
If you want to check Dr. Ashton, sit on the salt.
Well, no, I'm not going to sit on the salt on a demo, but I am going to explain how salt works. A little science, chemistry.
All right. Thank you, Dr. Ashton.